Hey there, and welcome to Connect the Dots Learning Center podcast. I'm Stephanie Wagers, your host, and I'm so glad you're here. Whether you're a seasoned therapist, clinic owner, or just starting out, this podcast is your go to spot for insights, tips, and stories that'll help you connect the dots in your practice. Today's guest might make you rethink everything you thought you know about early intervention. Patricia, an OT speaker, author, and clinic owner, is dropping powerful insight on how what happens during mom's pregnancy, especially with conditions like preeclampsia, isn't just a medical stat. It's a developmental story we need to pay attention to. From the NICU to your therapy sessions, you'll start seeing patterns you didn't know were there. You'll want to share with your whole team. Welcome, Patricia Corbin. I'm really glad to talk with you today. You're an OT clinic owner and the founder of the Preeclampsia Project. And I know a lot of the people listening might be like, well, what does preeclampsia have to do with private practice or me as an OT, PT, or speech? And that's what we're going to talk about today. So I know you have a personal history with preeclampsia, and I kind of want to just hear that story first.
Great. Thank you for having me, Steph, to talk about this. It's such a cool topic, and of course, it's near and dear to my heart. As you mentioned, I did have preeclampsia when I was pregnant. It was about 22 years ago, and I had never heard of preeclampsia. No one mentioned it to me, and I was a high-risk patient. I did IVF to get pregnant, which made me high risk. I was pregnant with triplets. It was my first pregnancy, and I had an autoimmune disease. So all those things made me really high risk, but no one mentioned that this could even happen to me. I didn't know that there were some things I could do to decrease my chances of having it. I didn't know how to monitor my signs and symptoms, and I really didn't know how to recognize that I was in trouble until it was too late. So I didn't deliver till I was 34 weeks. I was at home. The best advice they gave me was stay at home, be on bed rest, and drink plenty of water, which I did. But there were some other things I could have been doing. And I noticed one day that the babies just were not moving much. And so I insisted that I come in to see my doctor. They tried to convince me that, you're small, you're a small woman, you've got three babies, and they're not going to move as much. You're not going to feel them this much now that you're further in your pregnancy. But I really insisted. I went to the hospital, and by the time I delivered, I was going into heart failure. I had what's called a cardiomyopathy. My heart was enlarged. I had kidney damage, and I had fluid in my lungs, and I lost one of the babies. So when it was time to be discharged from the hospital, that's when I started to realize how serious this was, because the children were ready to leave the hospital before I was. I was still being treated for pregnancy-induced hypertension, and I still wasn't given a lot of information about it. I wasn't told that I now had a high chance of having chronic hypertension later in life, that 2 out of 3 women who have preeclampsia will die of a cardiovascular disease. And I was at much greater risk for 15 years for developing a stroke.
Wow. And your baby, so you delivered at 34 weeks.
34 weeks. And
okay. And
twins.
Well, you had twins.
I had twins that survived.
Okay. And they were ready to be discharged before you were.
Before I was. Yeah. And that's when I started to realize I could have been in a lot of trouble. I had no idea. And, and of course, this was 22 years ago. It was before I could get on Google and Google the symptoms and find out more information. And I think they didn't know back then what they know now, too. So there were some things now they tell women to take a baby aspirin every day. And apparently decreases the chances about like 30%. And that wasn't something I did. And even though they were monitoring my blood pressure, I was never treated for high blood pressure. And my blood pressure was escalating as my pregnancy went on. I started out really low. I was started at around 90 over about 60, but I slowly was creeping up. And when I delivered, I was about 180 over about 120.
Wow.
And but it was never.
And were they telling you they were concerned at this point? Like you said, you started really low, it was gradually creeping up. And I mean, I'll ask this question too. Did you even really know what preeclampsia was?
I didn't. And actually, they never used the term preeclampsia with me. They just said, we're going to watch you closely for your blood pressure and your other signs. And so the other signs I was showing was I was so swollen. My feet were huge. My legs were huge. I had developed carpal tunnel syndrome because I had so much swelling in my hands and wrist. I had protein in my urine, And of course, I didn't even know what questions to ask because I foolishly thought, well, this is just because I'm pregnant with 3 babies.
Right, because that's what you hear about being swollen and, carpal tunnel and all of that.
Yeah, and the danger was that I did have that protein breaking down my urine. So when your kidneys start becoming damaged from this high blood pressure, you will start breaking down protein in your urine. And so this is an indication you do have preeclampsia, and you need to really monitor your signs closely. You need to really watch for these urgent warning signs and get to the hospital before it's too late. But for me, even though 2 of my babies survived, I did have to leave the hospital without one of those babies.
Yeah.
And so it was
Yeah.
really hard. And I
Yeah.
just didn't know the questions to ask. And I just kind of put all my trust and faith in my providers. And now, I want to make sure that doesn't happen to anybody else.
Yeah. Yeah. Well, that kind of started your mission, right? Into this whole project and what you've been doing so far, right?
Well, it actually didn't because I didn't even think about it for a lot of years because
Okay.
I didn't know anybody else that had preeclampsia. I never heard of it. People weren't talking
Hmm.
about it. And I really didn't think about it again until I started working in early intervention about 12 years ago. So I specifically work with babies transitioning from the NICU. So most of the babies I see are delivered between about 22 weeks and 28 weeks gestation.
Hmm.
And more and more of them were being delivered earlier and earlier and sent home with feeding tubes, some of them still on ventilators, but all very small and
Hmm.
with significant delays. And I look at my caseload, and the majority of them were born to women who had preeclampsia. And I live in Southwest Georgia. We live in an area where we just do not have a lot of OB providers and OB hospitals.
Hmm.
This area is considered to be a maternal healthcare desert where women are driving an hour and a half to see an OB provider or an OB hospital.
Wow. Wow.
And that's kind of how I started thinking about preeclampsia again because I thought, oh my gosh, this is still happening all these years later. But so when I started early interventions, like I said, it was 12 years ago. And that problem has not really changed much, but I'm still seeing
Hmm.
issues.
Why do you think that preeclampsia is so under discussed? I mean, obviously, it's a huge problem.
It is. And I think there's a couple of reasons, Steph. One of them, I think, is that, when we first deliver, all of the information and the care provided is kind of prioritized to the infant. And so the woman kind of gets pushed to the side. We're now thinking about this baby when they come home. And with preeclampsia, you can have preeclampsia for 6 to 8 weeks after you deliver. And in fact,
Mm.
over 80% of women die during that postpartum period. So I
You
think
said 80%, right?
yes, in Georgia, it's 84%.
Oh my gosh.
So we think, we just had the baby, we think we're fine. Okay, our part is
Right.
we delivered, we're safe.
Right.
But really, we're at higher risk once we go home. So more and more women are dying once they go home, especially in these areas like Southwest Georgia, where we
Mhm.
just do not have OB hospitals nearby or a provider nearby for a woman to go to. So she's got lack of access, and then she may have lack of transportation. She may not have a
Mhm.
caregiver to watch the children while she goes an hour and a half drive to the OB provider or hospital. So a lot of the women will stay home, and if they're not aware of the symptoms, if they're not aware that they could die from something that's
Mhm.
preventable, then they
Mhm.
miss going to the hospital.
Right.
So that's one reason. That lack of access, I think, is a huge reason. Um,
Mhm.
a lot of women will tell me that their concerns were dismissed. People just aren't listening. There's now a CDC campaign called Hear Her, HEAR.
Okay.
And that campaign was made because so many women will say, nobody would listen, nobody
Yeah.
would believe me. And that's something I hear a lot in my region is that nobody would listen. I read a research study recently that said 30% and up to 50% of maternal mortality was contributed by discrimination. So we know that for whatever reason, there's implicit bias, there's discrimination, there is racial bias in providers, and
Mhm.
4 times as many Black women will die than white women. And in fact, in Georgia, more Black women die than every other race and ethnicity combined. So we know that there's just so much inequality to care that exists. So a lot of these women are being missed, and it's just not talked about enough.
I mean, that right there is enough. But what was your turning point that said, okay, I've got to do something about this?
So there was a couple of things that happened. So I met a young woman about 12 years ago who she was 19 when she brought her baby home from the NICU. And when I got to her house, I always asked my moms, tell me about your pregnancy and tell me about your birth story.
Hmm.
And that's where I get so much information that I need to help them with their baby. And she told me that she had to deliver early because they were worried about the baby. And everything she told me was about the baby. And I was
Hmm.
looking at her chart and I saw on her chart, she in fact delivered because she had preeclampsia. And her blood pressure was around 210 for about 160 when she delivered. She could have died. And so as I'm looking at her chart and I'm listening to her story, she never mentioned once that they were worried about her. And so I finally said, no, they were worried about you. And she looked shocked and she said, well, Patricia, that can't be true. My doctor didn't tell me that. My nurse didn't tell me that. The midwife didn't
Wow.
tell me that. This can't be true. And I gave her all the information I had. And of course, I didn't know back then what I know now. I know so much more about it now. But I told her what I knew. And when I left the house that day, I thought, well, maybe I'm not the right person. I'm not a nurse, but I did
Hmm.
give her the information I had. And we had a wonderful relationship. We worked together very closely for many years. Um, Her baby was born at 22 weeks, 6 days. And so I met her right when she came up from the NICU, and her baby had significant delay. She was small for gestational age. She had intrauterine growth restriction,
Okay.
and her baby did end up getting diagnosed with autism later, as many of these children do. Um, and then I didn't see her for a little while. And about 4 years later, I got another referral for her next baby. And I was looking at the referral and I saw this baby was delivered at 34 weeks. So I thought, well, maybe she did better this time.
Yeah.
Maybe
Yeah.
the pregnancy was better and she was safe. So I get to the house and I'm knocking on the door. And the little girl that I had seen years earlier had dragged a chair over to the door to unlatch it for me. So when I come in the house, I see the mom laying on a sofa and she can barely lift her head. And so I said, oh my God, what happened? And she said, Patricia, I've always heard that Black women were more likely to die than white women from being pregnant, but I didn't know I could get so sick. And she was another high risk patient. She
Hmm.
was under 20 for that first pregnancy, which made her high risk. She was Black, which made her high risk. She had a family history of preeclampsia. This was her first pregnancy, the first baby I saw. So she had all these risk factors and she was on Medicaid that made her at much greater risk for developing preeclampsia, but no one mentioned it to her. Then she delivered and had a baby because of preeclampsia. No one told her, this is what happened, and here's how you protect yourself from the next pregnancy. She was never told. So when I get to her house for the second pregnancy, she said, I'm on dialysis now and I need a kidney. I have to get a kidney. And Steph, unfortunately, she passed away about 8 months
Oh,
later.
how many
And so
months later?
8 months later,
Ah.
she passed away because she needed to get a kidney. And by then, her heart, she was going into heart failure as well. And she did not get that transplant. So when that happened, and by then, of course, I'm very close to this young woman.
Mhm.
And I was about 40 at the time. She was in her early 20s and she didn't have a mom around. And I just felt like so angry and so sad. And I thought, I
Mhm.
will never let another woman die because she was an information.
Yeah.
And that's when I realized you do not have to be a nurse to give education. So I decided at that moment that I will tell every woman I meet about her risk for developing
Mhm.
pregnancy. That's what I did for many years. I share with every woman I meet. Of course, I'm getting them after they've already delivered their baby and they're coming home most
Mhm.
of the time from the NICU. But I do let them know, like, look, you're at greater risk for your next pregnancy. You've got to really plan this pregnancy carefully. I work for the Department of Public Health. We have free birth control. It's going to be very dangerous if you get pregnant within 2 years. So there's some things you can do, and here are the signs you need to look out for, and here's how you can monitor. But as an OT, I gave her information. I give all them information about healthy lifestyle choices,
Right.
eating better, trying to lose weight, drinking more water, moving your body every day, just getting in better habits and routines. And so that's what I've done for a while, but that still really wasn't the turning point that for me to make the preeclampsia project. What
Mhm.
had happened was I'm looking at my caseload and I see more and more babies. About 80% of my caseload are now made up of kids who were delivered because of preeclampsia and have early markers for autism. And on one particular day, I had two women tell me the same story. They said, Patricia, when I delivered, I presented to the hospital 3 times. And the first 2 times I was turned away. I was told, look, you're over 35. You're overweight, and this is your first pregnancy. And they were told pretty much to toughen up. You're not in labor, and your blood pressure isn't that high. Well,
Wow.
yes, they were like me, and they started out with low blood pressure, but their blood pressure
Okay.
was slowly escalating as the pregnancy went on. But they had all those other signs and symptoms. They had swollen legs. One of them told them that I'm seeing spots and I have a horrible headache. The other one told me that she was vomiting and had nausea for days, but it wasn't appreciated because the blood pressure wasn't considered that high. So what they were
Right.
looking for at the hospital was over 160, over 90 or 100. So they weren't at that stage where they thought this is critical enough for them to stay. And they
Mhm.
were early in their pregnancy. They both were about 23 to 24 weeks. And of course, when they're telling me the story, they're sobbing. And they said, but
Right.
they both said the same thing. Nobody would listen. I
Mm.
couldn't get anybody to listen. And so the first mom told me she delivered and she had HELLP syndrome and nearly died. The second mom told me she was having a seizure from eclampsia when she delivered.
Oh my gosh.
Those two things made me realize we've got to do something. I can't believe it's been, by then it was about 18 or 19 years since I delivered and nothing had changed. It
Yeah.
was 10 years after the mom that I got so close to had passed away from complications of preeclampsia, but nothing had changed. And so I stayed up late that night thinking, what can I do? I've got to do something. Something has got to change. And that's when I came up with this idea that what if we partner with everybody in the community who has a role that places them in contact with women of maternity age? And what if we give them the information they need to know to protect themselves and to at least recognize those urgent warning signs that they're in trouble? But I wanted
Mhm.
all of them to know, hey, this is something you're at risk for. Here are your risk factors. This is what you're at risk for. Here's how you can modify your risk by making changes in your lifestyle and your healthy eating habits, and whether or not you're drinking enough water, whether or not you are taking an aspirin, if you're moving your body every day for 20, 30 minutes. And so I started thinking about that idea of partnering with people in the community. And I went to the
Yeah.
director at the health department and I said, I have this idea. What do you think? And she said, I love it. And so I started partnering with everybody I could partner with in the community. And then I came up with an idea to monitor their signs and I made a kit. Do you want to see the kit?
I do want to see the kid. Yes.
So I have this kit that I made. And in the kit, I placed a blood pressure monitor in your intestine strips. Because as I mentioned before, that once their blood pressure is so high that it's damaging their kidneys, they're going to detect protein in their urine. And this is a simple, cheap way to do this at home. They just key on the testing strip and it shows up immediately whether or not they have protein in the urine. And then I put compression stockings and a little measuring tape. And of course, information. I have in English and Spanish little brochures about preeclampsia and the risk factors and how to monitor the signs and symptoms and
Amazing.
how to recognize those urgent warning signs. And the great thing about this kit is that it has products that you can just buy at Walmart. There's nothing in
Mhm.
here special. You don't have to be a doctor or a nurse to get these products. I can just go to Walmart and get them. And all the information that I give, someone could watch on TikTok. It's not like you have to be a nurse or a doctor to get this
Right.
information. It's just education.
So I know that you've run into some challenges when you've been trying to do this. Do you want to kind of talk about that while you're trying to build your program?
I do. So whenever I talk, when I'm trying to partner with people, and when I try to present this
Yeah.
information to the public, even when I present it to the health department, which I've worked for many years, they said, Patricia, I love this idea. It's a great idea, but it seems like a nursing initiative.
Mhm.
And so I had to really help them see what my background as an OT was, what my scope of
Mhm.
practice was, what my education was, and really explain how OT is the perfect partner to address these needs in the
Mhm.
community. And I explained to them how we take this very holistic approach. And what I'm trying to do is to prevent illness. And what I'm trying to
Right.
do is promote health rather than taking that medical model where they wait till it happens and then they treat the illness as it occurs. So that's been a huge battle is that one, the other providers don't really know what we do. They don't understand OT, particularly in maternal health and the public, in the public health area. And so once I was able to describe to them what we do and what my scope of practice was and what my goal was and how I take this OT lens of promoting health and preventing illness, they understood and they were like, this is a good idea. But I still come into, there's been times where people are like, it just seems like this is something nursing should do. Even when I talk to other OTs sometimes, they'll say, well, how is that my role? How am I allowed to give this information?
Right.
When I assure them that these are products you get at Walmart and it's just education, and we really cannot afford to let another woman die just because she doesn't know.
No, and you mentioned should do, like nursing should do this, but it's not happening. And I feel
Right.
like as OTs, that's where we're like this like leak stopper of things sometimes by, we can see the bigger picture and provide the education. Well, let's kind of bridge the gap a little bit. How does this relate to them and why should they really start paying attention to it?
It's really important for pediatric providers. And that's actually how I got involved with this because I practice in peds.
Mhm.
And I'm sure if you look at your caseload, you probably, especially your kids with autism, if you went back and asked the moms to tell you about their pregnancy and their birth history, if you find out that they were delivered early, there's a good chance they were delivered early because of preeclampsia or because of a pregnancy-induced hypertension. And so what happens, Steph, is during the pregnancy, if mom has pregnancy-induced hypertension, she's not getting enough blood flow herself. Her kidneys
Right.
are dead because she doesn't have enough blood flow and oxygen in her brain. I mean, she's having all kinds of catastrophic illnesses and injuries as a result of that very high blood pressure. And it's sustained for so long through that pregnancy.
Mhm.
Well, those same issues impact the placenta. So the placenta is not fully supporting the fetus. So the
Mhm.
baby is going to have issues with their brain health. They're going to, they have a much higher incidence of neurodevelopmental disorders with autism, with ADHD. And if you ask that question, you can kind of see ahead of time, you can kind of predict, well, this could happen to this child. So if
Mhm.
you're getting them and you know they're so dysregulated all the time, they have all these sensory issues, there's a good chance that this happened. And if you know ahead of time, we can put them in a surveillance program and we can start watching for it early. But we can also be coaching the parents on what to do because they don't
Right.
know what to do. They're coming, my families are coming in from the NICU and they weren't fully educated on how sensory processing is going to affect development
Mhm.
and how that insufficient placental support is going to affect development. So most of them are born with intrauterine growth restrictions, so they know they're small, but they're also born too early and they don't have that suck, swallow, breathe reflex. So
Mhm.
they're out needing feeding tubes. And those feeding issues rarely resolve before they come. Once they come home, most of mine are on feeding tubes still, and those feeding issues continue for many years.
Mhm.
So by the time they get to your clinic and they're say 2 and 3 years old and they have feeding issues, the parents might say, "Oh, they took their bottle fine," but then when you look at old videos, if you could say, "Can I see a video of the baby eating when they were little?"
Yeah.
You can see there's been a problem for a very long time. So
Right.
often my moms will say, "Yeah, they eat fine," and then as I'm asking more questions, I find out it takes 1 hour to eat 2 ounces. And then
Mhm.
they're flooded and there's milk all over their neck. The mom will say, "Oh, I have to change their bib 5 times a day because so much milk leaks out."
Mhm.
There's so many feeding cues that they're struggling with feeding. And I'm able to help the parents. That's something pediatric providers are so good at doing is showing them, hey, you're missing some of the feeding cues. We're seeing them finger spraying and turning their head away and milk's running out of their mouth, or they're coughing and clearing their throat, or the milk's coming out of their nose. They're just
Right.
refusing the bottle by turning their head away, or it's taking a long, long time
Long
for them to
time.
eat. And they don't
Yeah.
realize that that's connected to them being picky eaters today. So when they're
Right.
2 years old, they don't realize, oh, that feeding issue they had all those years ago. Or when I say, were you able to nurse from the breast? And they say, no, they never could latch. That's another indicator that there could be something else going on.
Mhm.
But the
Mhm.
biggest thing I think that really impacts the babies besides the feeding is this dysregulation. They are so easily dysregulated because they're born and they had no physiological regulation. Their blood pressure was unregulated, their heart rate was unregulated. And so you have these kids who are in constant fight or flight. And so that is something so important for pediatric providers to know that we have
Yeah.
to prioritize regulation. We have to help parents understand their important role as co-regulators. And sometimes the parents are not regulated. They're scared. Their baby's not
Yeah.
eating. They're terrified. And they're frustrated because the baby doesn't eat. And so their patience is low. So we have to regulate with the parent to help them calm and collect and to be able to recognize the feeding cues. The baby needs a break. We have to give the baby a break. They need to reset that suck, swallow, breathe because they are discoordinated. They're just unorganized in general, but they're also really weak. A lot of them have breathing issues from being on ventilators or being on CPAP for so long. And it takes a long time for them to be able to get that coordination to properly suck, swallow, breathe, and then learn to eat different textures, learn to chew because they've not used those muscles and so long they were weak.
Right.
And then helping them really regulate because they're going to have meltdowns quickly. So once we can get regulated and they feel safe and we can decrease that fight or flight response, it's going to improve their outcomes.
You dropped so many knowledge bombs throughout that. I think, going back a little bit, give me 2 or 3 specific questions that a peds provider could ask a mom. If we look at the clinic, it's really fast paced. We have an hour to do the evaluation. We've got to take birth history, developmental history, and then assess the child and do all our clinical obs. What are 3 questions that could be indicate that maybe there was preeclampsia or difficult pregnancy where maybe a parent wouldn't think to mention it because it was never, told to them that it was a big deal?
Ask them if they delivered early or if they
Okay.
delivered by C-section. And when they say, because most of them will have to deliver by C-section.
If
So
it's early.
yeah, and if they have preeclampsia, because it's either urgent and they have to do it quickly because it's progressed so far that they're going to have a seizure or they're going into heart failure, or the doctors have scheduled it at 37 weeks because they know at 37 weeks they're most likely to have a progressing event of preeclampsia at 37 weeks. So if you ask them, did you deliver early? And then ask them why. So if they said, oh yeah, my blood pressure was getting high, that's the first place to start. Ask them if they were able to feed from the breast. And if they said they can't, or did the baby have issues even latching to the bottle nipple? And tell me what happened when they tried to latch. Was milk running out of their mouth? Did you notice they were coughing and clearing the throat a lot? Did they fall asleep a lot? A lot of times the moms will say, well, they just fell asleep. And so sometimes they fall asleep because they're so weak and they run out of energy. Their activity tolerance is so poor, they can't remain at the breast or the bottle long enough to finish a bottle, or they're so weak that they're sucking for so long, but it's been an hour and they're still sucking and they've only taken 2 ounces. But the other thing that happens is these kids are so dysregulated, their brain just shuts down. They're in fight or flight, their higher cortical functions shut and they go to sleep. So those are
And you're relating that to the physiological distress that they had by not getting enough blood in utero, correct?
Yeah.
Okay.
Yeah.
And I think that is a fantastic way to explain it to a parent so they can go, oh, I get it. I see why they started out dysregulated and now we need to teach it.
Yes.
Yeah.
And their central nervous system was so immature. The first week that they're in the NICU, we can't even touch the babies because they're so easily dysregulated that even changing their diaper can cause an increase in their blood pressure and we can get a brain bleed. So most of the kids that I see will come home with grade 2 and 3 brain bleeds because those vessels were so fragile and so tiny. And like I said, something as simple as a diaper change could cause an increase in blood pressure. But they're also getting CPAP. They're getting sometimes intubated. They're getting feeding tubes. So of course that's going to really dysregulate the baby. I mean, they're as careful as they possibly can be. But if you're intubating a baby emergently, you'll probably end up getting a brain bleed. And then sometimes, if they make it to 37 weeks or later, we have hypoxic events where the baby just has no oxygen. So they're born hypoxic. The mom may say, yeah, their APGAR score was 0 or 1 or 2. And then we find out, okay, she had preeclampsia, and she had an emergency C-section at 38 weeks. Maybe they didn't realize, or she could have been one of those moms that was far from a provider and she wasn't able to get the care that she needed. So the provider didn't even know that she was going to have preeclampsia. Sometimes it happens very quickly. And if they're not aware of their risk and those urgent warning signs, they may not get to the hospital in time. And then we've got a baby that's born after a hypoxic event and they end up in CP.
It almost seems like every child that has been born to preeclampsia should be referred for services, just for screenings, right?
Yeah, I just got goosebumps you saying that because,
I mean, it's like chicken and the egg, right? Like,
yes,
let's just
yes,
screen them and keep screening and
I wish they
catch.
would. I wish they
Yeah.
would. And
Oh yeah. Oh yeah.
initially, when I went back to get my PPOTD, that was my initial goal, was to do a surveillance program. I wanted to come up with some kind of screener to give to every baby in the NICU who was delivered to a mom who had pregnancy-induced hypertension, because I wanted to make sure those women knew about the risk, but I wanted
Yeah.
those babies in an early surveillance program. And I wanted them to get an immediate referral for early intervention, because if they leave the hospital and are age adjusted newborn, they may not get a referral. And most of them don't. Most of them do not get a referral for early intervention. And when I get them, when I see them, I already see so many early markers for autism. So, and that's another thing that pediatric providers need to know. We can see those markers very, very early. So generally around 6 months, I'll see, and sometimes a little earlier, but I'll see these repetitive movements, and they are very uncoordinated. They're not making any eye contact. And normally when the mom's holding the baby and she's feeding, mom's looking at the baby, baby's looking at the mom, and we just don't see that with these kiddos. When they get closer to 10 months old, I'm seeing that they're not responding to their name. They're not cooing. They're not saying dada. They're not making consonant sounds. They're, in a few more months, I'll see that they're not pointing. So the benefit of knowing that these kids are at risk and us getting them earlier is because we can change that trajectory that they're on and hopefully decrease their risk for having autism and getting them more services. We need to get them in speech really early. We need to get them in OT. We need to get them in PT when they're uncoordinated like that and have low tone and they're weak. So if we can all work together to get that early intervention referral started, it'll really change the outcome for the baby for the better.
Parents never want to hear anything's wrong with their child, of course, right? But it's almost like physicians we're not saying anything because we don't want to make the parent worry. But by doing that, we're creating this larger problem when it could have been, solved or changed in the very beginning.
Right. Right. And I have several very good friends that are pediatricians, and I often ask them, why not refer them all? And she said, Patricia, you have to remember that I'm seeing thousands of babies a year, and most of them catch up. Many of them will come in and the parents are worried, and I'll see, I think they're going to be okay. I think they're going to catch up. And a small percentage of them don't. And so I appreciate what they're saying. But then again, if you know that the mom delivered at 23 weeks gestation and she had preeclampsia, and we know the baby had intrauterine growth restriction, we really have got to get that referral early.
Yeah, and that's why I feel really strongly we need to have pediatric OT PT speech in the primary health system, in a pediatrician's office, because then, you could run a group, you could have new baby groups, all of it, where you could just educate, screen, give parents the, where they should be and identify those kids right away.
Yes. Yeah. And they're not really the experts in development. They're the experts in health and illness.
Exactly.
And so sometimes they're not even aware, like, oh, I didn't realize that was an indicator. Because sometimes I'll come to them and say, hey, they've got all these markers, these early markers for autism. And so, as a therapist, we're able to educate the pediatricians even and primary care providers. But these are all markers that we need to look for. And this is a delay, a significant delay in development that we could change and coach the parent to improve.
Well, until we can get into primary care, because it's a whole battle, right, with billing and insurance and all that, what can we do within our clinics or wherever a provider is working to help raise awareness?
I think as therapists, if we know that risk is there, and hopefully everybody that's watching today will know, these risk factors. And can I share a couple more risk factors?
Please, please.
So we know that women under 20 and women over 35 are at greater risk. So if you just remember that the extremes in the ages, if it's a young teenager or an older woman, then she's at greater risk. We need to tell her, hey, you're at risk for this. We know if it's their first pregnancy, they're at much greater risk. And the reason for that is the placenta is only half us and half of our partner. And our body sometimes sees that as a foreign object that needs to be attacked. So if you already have an autoimmune disease like RA or type 1 diabetes, or lupus, you're going to be at much higher risk because your body already has this inflammatory markers that will see anything foreign as needing to be attacked. So that placenta is going to be seen as something foreign that our body might start attacking, causing preeclampsia to develop. If the woman already has high blood pressure, of course, she's going to be at much higher risk. Or if she has gestational diabetes, because again, she's got these inflammatory markers that may increase her chance of her preeclampsia. If she's African American, she's at much higher risk. And I probably mentioned earlier that African American women are 4 times more likely to die from preeclampsia than any other race. So they need to know they're at much higher risk. If you have kidney disease, you're at much higher risk because your kidneys are not functioning as well. Oh, if you're overweight, you're at much higher risk because again, you have inflammatory markers. For me, I did IVF, but any assisted reproduction is going to put you at higher risk. That was something that.
Did they tell you that?
No.
I've never heard that before.
Never mentioned. And when I meet other moms who've had multiples who did IVF, they are shocked when I say, yeah, that puts you at higher risk. And, but when you think about IVF, I mean, it's a business.
It is business.
And they're in the business of getting you pregnant. So then once you're pregnant, then you move on to your next provider. So that's something that we can share with our moms when they come in is on all these risk factors. If you had preeclampsia in another pregnancy, of course, that's going to make you high risk. The other thing is if you delivered in less than 2 years or greater than 10. And that seems to be the area where I have the most clients because I'll either have a really young mom, it's her first pregnancy, or I have an older mom over 35, which will say, I had my kids when I was, back when I was 18 or 19 years old. And now I'm remarried and I'm having a baby with this new partner. And now they're 36, 37, 38. And it's just harder on our bodies as we age. We're more likely to develop hypertension when we're pregnant. We're more likely to develop pregnancy-induced diabetes, so gestational diabetes. So these things put us at much greater risk. So when you're seeing these women of maternity age in your clinic, it would be a great idea and a great service to them to tell them, hey, you're at risk for this, particularly if you're seeing the baby because they were delivered early from preeclampsia. You really might be the only person that tells them.
So kind of as we conclude, if there's one wish that you wish every woman knew, what would that be about preeclampsia?
There's a couple of things when I talk to providers that I wish they knew. The first one is you do not have to be a nurse to give education. And the second thing is we cannot let another woman die just because she does not have this information. We have to give her this information. And the final thing is if you have contact with a woman of maternity age, you really have a responsibility to tell her. If you know this information and you know she's at risk, we really do have a responsibility as providers to educate her and give her this information because you really might be the only one and it could potentially save her life. So I wish everybody could know that and hear that.
Yeah, that's huge. And you're so right because you didn't hear it. I have 3 kids. I never heard it.
And you may meet somebody else now that's pregnant that may say to you, oh, my legs are so swollen. And then you can ask her, are you taking your blood pressure? And, that might be the way she finds out. And a lot of people have told me like, I'm not at risk for this, but then one of my friends mentioned it to me or my cousin or my auntie. So many people have said that I've talked to about it have said, I was able to tell her that she was at risk. And sure enough, she was.
Well, where can people go to find more about your preeclampsia project or just you in general?
Okay, so I'm glad you asked me that, Steph. I'm on LinkedIn, so they can find me on LinkedIn. I'd love for them to link in with me, and I have all kinds of information on there. And I also have a website that's called thepreeclampsiaproject.com. So if they go to that, they can find me and email me, and I'll email them back. There's also lots of information on what's called the Preeclampsia Foundation. You can go to their website, and they have all kinds of information you can share. I mentioned the CDC Hear Her campaign earlier. This is a wonderful campaign because all of their promotional products are free. So you just have to pay to download, and they have information about urgent warning signs, not only about preeclampsia, but also about maternal mental health. If I could mention this real quickly, 20% of the deaths, maternal deaths that are associated with pregnancy, have to do with postpartum depression and drug overdose. So we have women who are dying from postpartum depression, and no one is even asking them. We have wonderful screeners that OTs can use to screen. So there's lots of extra information they can find on that Hear Her campaign CDC website that is free.
I'll put all of that in the show notes. But wow, it's been fantastic talking to you and a wealth of information. Something that we all need to know about. And you don't think you need to know about it, but you really do. Yeah.
Yes, it was a pleasure being here today too. I really am grateful that you invited me.